Yeah, okay.
Carol, you want to sing for a minute?
One more.
Oh, Lord, you don't have to move my mountain. Just give me the strength to climb. And Lord, don't take away my stumbling block, but lead me around.
Yeah.
Lord, I don't bother nobody. I try to treat everybody the same. Oh, Lord. But every time I turn my back, they stand and deny my name. Oh, Master. Oh, Lord. You don't have to move my mountain, but give me the strength to climb. And Lord, don't take away my stumbling blocks, but lead me all around.
Yeah.
The way the city operates, they want the sort of people who access these centers, working class people, poor people, black people, Latino, white, what have you, who don't have the means to go see a private therapist or a psychologist to just, to fall through the cracks, to disappear. And part of what we've been trying to highlight by being out here is to say that, we're not going to just let ourselves kind of be swept away and disappeared. We're going to continue to raise this issue because this is the fundamental issue of human rights. It's a fundamental issue of fairness.
Fight, fight, fight! Because healthcare is a human right! Fight, fight, fight!
Even though the police came here and they told us that we couldn't have our tents up, that we couldn't camp out here and continue to reach people in the neighborhood, we're committed to being out here and to making sure that folks know that this center that people fought for 40 years ago and that they demanded come to Woodlawn is slated to be closed. The city has been laying off caseworkers, it's been laying off therapists, and it's, as much as now it's actually trying to close the center, it's been bleeding it in terms of actually undercutting the capacity.
And where would people go if they don't go here?
Nowhere. There's nowhere to go.
I'll come up in 1 second, okay? Just let me.
They've been told that there's centers, that there's a mental health clinic in Inglewood, and there's one in Roseland. But you have to understand that accessing mental health care is not the same as just going to like a public clinic. You have a relationship with a therapist. That relationship is essential. If your therapist gets laid off, it's not a simple thing for people who work up the fortitude to be able to go out and claim the fact that they have a mental disorder, the depression, bipolar disorder, what have you, to start fresh and go to a neighborhood or a part of the city that they're not familiar with.
Don't nobody know how I feel. I've been in jail all day today. And you know what? I don't care about going back to jail. I don't care. Because you know what is wrong? Because I feel in my heart, I'm going to stand. I'm going to stand. I'm going to fight until the day I die. Till I die. They should close the center down. They got rid of my therapist and everything and stuff like this. I've been walking here. I live on 65th and King Drive. And I go to New Beginnings Church.
Sister Linda, we're gonna start the press conference real quickly. She's gonna be one of the speakers.
I'm one of the people who got arrested last night. Many of us, my last name is Kortchmar, Kortchmar. Many of us in the mental health movement have been out here. We've been around the clock in a fight specifically centered around this clinic for the past 2 weeks, and in a fight much, much longer for all of the city's mental health clinics and public services. We've been out here doing this peaceful protest 3 times. We have received brutal police repression. Last night we had over 30 police officers who came out. That's the 3rd time again that we've had 30, 40, more than that. At the same time in this neighborhood 6 blocks away, there was a shooting last night and there was 1 police vehicle that came out there. One of the reasons that these clinics are so important is because of the violence that's going on, because of the hurt that people have, because of the chances these clinics offer people for transformation, for forgiveness.
Hello, my name is Rosalind Witherspoon and I'm a consumer. they arrest the people just because they got their human rights, the right to go to a mental hospital, right to go to a mental clinic, and they arrest the people because they believe in that.
Fight, 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 because healthcare is a human right. Fight, 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 because healthcare is a human right. Fight, 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 because healthcare is a human right.
I'm a consumer and an advocate for the mental health movement. We have been told for 6 months now that there is a safety net, and the city's public health clinics that are remaining, the 6, will be the safety net for those that do not have insurance. I learned this morning from a person that tried to access that safety net that it costs $165 to access the city's safety net. So there is nowhere for people that have no insurance and no money to go. So we will be looking at dead bodies strewn around the city, and the only thing the city will say is, we tried. If we failed, it's because the people did not come to the clinics.
The community here supports us and is behind us, and when we see stuff like we saw last night where the police resources are being used to arrest people, that is definitely a clear misuse of those resources. At the same time, we expressing these needs here from the city over and over again, that the needs are being met. The city says they have a transition plan in place and that transition plan is functional. They say that people are getting the care that they need. We have heard a mountain of evidence from consumers at these clinics, people who use these services, from therapists, from doctors, from allies, from organizations all across the city that say, no, the transition plan is not working. People are falling through the cracks. People are being hospitalized. People are being taken to jail because this plan is not working.
How confident are you that your protests are going to keep these clinics open when the mayor talks about he needs to balance a budget?
Well, when he talks about balancing a budget, he's talking about budgeting for results. And in budgeting for results, you're not going to just continue to fund the same programs because you gave $50 million last year. Well, we'll give them $50 million again. Now we're looking at priorities. We're measuring performance, but it's based on public demand. What does the public want? And you see here, we've set an agenda, and the public is demanding public mental health services be restored in our communities because we need healthy communities.
On this tent, we have the names of all 6 clinics facing closure.
So we ask everybody
Not to go anywhere.
a number of pastors
Been worrying about us who are going to be in jail.
that worrying about us
We're
who are
going to jail. We'll be out by morning.
All immigrants, non-immigrants, citizens, all human beings, we deserve a mental health care system with justice. They are trying to close down a clinic here in this neighborhood, where is a poor neighborhood, and also in places like a little village, Northside, where all the poor receive health care.
I understand that this is not just an occupation of trying to keep clinics open. This is an occupation of trying to save lives. This is an occupation of trying to save the foundation of families. Everybody, I'm sure, has it might be an uncle, it might be an aunt, or somebody that's on psychotropic medications. Sometimes we have learned to lose them in the mix. But when they go to their therapist, when they go and get their medications, the expectation of the therapist is that they take their medication. If these people do not go and take their medication home and just put it on the shelf and no one is there to help them, then it becomes a problem. They start acting out. They have all kinds of problems. Dealing with those problems is a serious issue. It's a serious issue because it becomes an issue for the community. It becomes an issue for the police. And then it becomes an issue for hospitals. And hospital stays are quite expensive. A crisis worker at a hospital, if she sees 13 patients in one night that's a problem. If the hospital psych units are constantly being filled with people that could not get their medication or could not get their therapy from clinics, that's a problem. This city needs to understand it, they need to embrace it, and they need to call Rahm Emanuel and the City Hall and let them know, alderman by alderman, that this is a time when we need mental health care.
I knew Helen Morley for about 3 years, and she was a strong advocate to keep the mental health clinics open. Every activity, every opportunity, she gave interviews, she passed out flyers, she went as far south or as far north it was necessary to tell the story of how important the public health clinics are and were to her. She told Mayor Emanuel, she was less than 2 feet away from him when she said, "Mayor Emanuel, do not close my clinic. If you close my clinic, I will die." The clinic closed April 30th. She died June 6th. She also told not just Rahm Emanuel, but she must have told the health commissioner, Shuker, at least a dozen times to his face, "If you close my clinic, I will die." She told her aldermen. She gave many interviews about how important the clinics were to her life and her ability to survive and thrive because of her therapist. And she told people, anyone that would listen, how important the clinics had been to her. Helen was not just an advocate, she was also a caretaker. She has a sister that was mentally retarded and physically retarded, and she went as often as she could to make sure the place that her sister was being housed and taken care of, that she was being treated humanely. Helen was an advocate for people that could not advocate for themselves.
No, right now we call them because the therapist made an agreement with their boss.
Oh, you have services over the phone?
Yeah, on the phone. That's why he's one of the ordinance.